Julia, first of all, where are we in terms of the progression of the disease?
First of all, Annette, let's remind our viewers that malaria is and can be a fatal disease, and it's due to a parasite that's transmitted to humans through mosquitoes. And not only is it preventable, but it is also indeed curable. And now for years we've been hearing the Global Fund, the WHO, tell us that not only should we eradicate the disease, but that we can eradicate the disease. But if you actually look at the numbers, not only has progress stalled, but the situation is now regressing. If you look at the numbers from 2020, for instance, there were an estimated 241 million cases of malaria worldwide, and the death toll stood at 627,000, in sharp increase compared to 2019. So, of course, there was COVID-19 there, but the situation actually got worse before that. Now, 95% of cases and of deaths linked to malaria are actually in Africa. And children under the age of 5 account for 80% of all those deaths in that area. And there's another alarming figure. It's that the fact that more than half of the people who've died from malaria have been identified in only 4 countries in Africa, namely Nigeria, the Democratic Republic of Congo, Tanzania, and Mozambique. Now, why has progress stalled and even regressed? It's actually due to a lack of resources, a lack of political will, not only from the governments and the countries that are the most effective, but also from the international community. It's also the fact that we tend to let up on efforts a little too early. For instance, China last year was able to eradicate the disease altogether, but it poured so much investment. Now, just to give you an idea, according to the latest report by the WHO, in 2020, we invested about $3.3 billion to fight malaria when we should have been around $7 billion. And if we were to really try to reach the target that was established by the WHO to, reduce the prevalence of the disease by 95% in 2030, we would need to pour about $10 billion. So we're 3 times under that.
So why are we not reaching the goals, even though there are so many tools available, such as the tools, about prevention?
There are so many tools indeed. We have such a wide array, especially when it comes to stop the transmission, because this is actually the most important part. This is what we call vector control. So you have, for instance, medicine that you can give to people that will kill the mosquito if they bite you. You have so many different tools indeed. But actually, the tool that's the most effective today is actually very frugal. It's the insecticide-treated mosquito nets. They're very effective indeed. Now, prevention is key because if you can be diagnosed early enough, you can be treated. You're usually treated with a combined anti-malarial therapy with Artemisinin. Artemisinin is a molecule that's contained in a plant called Artemisia annua that you're going to find in all of the treatments against malaria. And in some countries in Africa where they don't have access to anything else, they actually drink it as tea as prevention. And according to a study that we conducted here at France 24 in one of our reports, it actually works really well, even though the WHO is still quite skeptical. Now, there's also the development of vaccines, and we actually spoke about this a couple of weeks ago on this set, because there are about 50 vaccines that are being developed throughout the world, but none of them are reaching a 50% efficacy rate. The reason why is because those parasites actually tend to mutate a lot. Now, recently, the laboratory GSK that developed the vaccine RTSS had this idea of combining it with another drug, and according to clinical trials they conducted it in 3 different countries. It seems to be very efficient. Now, last but not least, the last tool that we have is genetic modification, using DNA scissors to be able to get rid of some genes to make sure that some mosquitoes, for instance, not only cannot carry the disease anymore, but they can't transmit it, or altogether try to make sure that they can't reproduce. Now, of course, that raises many ethical questions because you don't know what could be the unintended consequences of getting rid of a species altogether, not only on the ecosystem, but also on other species.
So it does seem like we're losing the battle against malaria, Julia, and the problem as a result could be spreading to other countries.
Exactly. That's according to a new study that was published in Nature Communications. It says that because of the rapid melting of the ice caps in Greenland, for instance, there's going to be a massive influx of fresh water in the Atlantic Ocean. That's going to disturb and disrupt, of course, the climate. And so what we could see in the years to come is the reduction of the risk of malaria and transmission by these mosquitoes in sub-Saharan Africa, as we saw earlier. But it could actually now be more prevalent in South Africa.
It is extraordinary, isn't it? It's yet another unforeseen consequence of climate change.
change.
Thanks very much, Julia Seeger, who